So as part of the course, you do get to spend quite a bit of time in simulation. So whether that is days that you have in the skills labs, or we do simulation weeks as well. So it can include a variety of things, so practicing clinical skills in a controlled environment, or it can be different scenarios. So for our simulation week last year, we practiced different skills, but we also had an A&E scenario, which is quite useful to practice when you know that nothing drastic is going to happen. The patients, well, the actors, because they bring in actors who are sometimes service users to help with the simulations. You know that nothing's going to go majorly wrong, so it gives you that chance to practice that skill, practice that scenario before going into practice, and then practicing it there.
Yeah, I think what's really good is that in the scenario that we were just doing about putting a catheter in, I ripped my gloves. I did part of the procedure wrong, but that's the really good thing about simulation, is that you can make mistakes. You can ask the questions, so then when you go into practice, you've got more confidence to go and do that procedure in practice.
I was just going to say, with doing adult nursing and mental health nursing, sometimes I can find it a little bit more difficult on my placements to maybe achieve some of the proficiencies needed to meet the NMC requirements, where I wouldn't particularly have them to hand to be able to carry out and complete on the ward. So what we do, the lecturers and the module leader will speak to the cohort and ask if there's any particular practices or methods we want to do in sim to help us build the confidence for when we're ready to go into placement and do them as well. And then we can also take the opportunities to go on to spoke days to complete those as well, to get those proficiencies signed off.
And one thing to remember is that simulation, although it's really good, it's effective, it helps you to practice, it is slightly uncomfortable in front of your peers, you know, talking to a mannequin that's not going to respond. It is a situation that you do need to get used to, but it does help when going into the hospital to understand the procedures and how to talk to the patients. But when you are in the hospital, it is a completely different setting, but it just gives you that advantage.
I think as well, you said obviously about working with your peers. I think it's a lot more awkward at the beginning of the course when you don't know the people that you're working with, and then you feel a bit more like, oh, I shouldn't really make a mistake. Whereas at the point that we're at now, I think we're all quite comfortable with each other, because obviously we've done nearly 2 years together. So if we make a mistake in front of each other, we just help each other. And obviously at this point, everyone's had different experiences in practice. People have different backgrounds before they came into the course. So you're able to help each other. So not only sort of having the lecturer's guidance.
Learning from them.
Yeah, so we learn from each other, learn from each other's experiences, and you do help and support each other along the way.
Just to say thank you for taking part in this conversation. It's really helpful to help other students that are going to apply for the course to talk to real students, or listen to real students and understand some of the experiences that you've had. So thank you.